This is the announcement that is applied to every recording. Unauthorized recording, audio, video, photography, etc., reproduction and publishing of these presentations and recordings are strictly prohibited. Thank you. Hello, today we are going to talk about the bones of the upper limb. And first we are going to describe the clavicle. Here is the clavicle and it is a pair bone, so this here is the right clavicle and this here is the left clavicle. The clavicle extends laterally and almost horizontally across the neck from the manubrium of the sternum to the scapula. So here is the clavicle, and as we said, the clavicle is a paired bone. It is a long bone and it is S-shaped, so you can see the shape of the clavicle. Since it is long bone, on the clavicle we describe the shaft. So here is the shaft and also two ends. This one here is called the sternal end, and that is the medial end. It is enlarged and it articulates with the manubrium of the sternum. Here is the lateral end, that is called the acromial end, and it is flat, as you can see, and it articulates with the acromion of the scapula. Here is the shaft of the clavicle, and since the position of the clavicle is like this, on the shaft of the clavicle we describe two surfaces, the superior and the inferior surface. So this one here is the inferior surface of the shaft of the clavicle, and here you can see the superior surface. Also, we describe two borders. This one here would be the anterior border, and this one here would be the posterior border of the shaft of the clavicle. The superior surface is smooth, and on the inferior surface, near the lateral end, we can see the conoid tubercle. This is the conoid tubercle, and also the trapezoid line. Here you can see the anterior border, and you can see that it is convex in the medial part, in the medial 2/3, and in the lateral part it is concave, and this is the posterior border. Since we said that the clavicle is a pair bone, we need to decide whether this is the right or the left clavicle. And to determine that, we use the fact that the superior surface of the shaft of the clavicle is smooth and the inferior surface is roughened here near the lateral end, and here we can find the conoid tubercle and also the trapezoid line. Also, the sternal end or the medial end is enlarged, you can see it here, and the acromial end or the lateral end is flat. Also here you can see the anterior border of the shaft of the clavicle, and it is concave here in the lateral 1/3 and convex here in the medial 2/3. And this we said that it is the posterior border. So here I'm holding the right clavicle. So the next bone that we are going to describe is the scapula. Here you can see the scapula, and also here, as you can see, it is a paired bone, it is a flat bone, and you can see that it is triangular in the shape, and it overlaps in part from the 2nd till the 7th ribs on the posterolateral thoracic aspect. So here we can see the scapula. As we said, the scapula is a pair bone, it is a flat bone, and it is triangular in the shape. On the scapula, we describe two surfaces. Here we can see the costal or the anterior surface, and here we can see the posterior or the dorsal surface. Also, we describe three borders. Here is the superior border, here you can see the medial border, and here you can see the lateral border. Also, three angles. Here is the lateral angle of the scapula, the superior and the inferior angle of the scapula. We also describe three processes on the scapula. Here is the scapular spine or the spine of the scapula, also the acromial process, that is the acromion, and also the coracoid process. Here you can see that is the third process. So one is the scapular spine, the acromial process, and also the coracoid process. Here you can see the costal surface of the scapula, and here we describe a shallow fossa that is called the subscapular fossa. On the posterior surface, we said that we can see the scapular spine, and the scapular spine divides the posterior surface of the scapula into the smaller supraspinous fossa and larger infraspinous fossa. So we said that on the scapula we describe three borders. So we said that this is the superior border of the scapula, this one here is the medial border of the scapula, and this one here is the lateral border of the scapula. On the superior border of the scapula, near the coracoid process, we describe suprascapular notch. So here you can see the suprascapular notch. This one, the medial border of the scapula, is parallel to the vertebral column, and here is the lateral border of the scapula, and here in the superior part we can see the infraglenoid tubercle. So this is here the infraglenoid tubercle. Also, we said that we describe three angles. So here is the lateral angle, and the lateral angle is where the lateral and the superior border meet. Then here is the superior angle of the scapula, and it is the place where the superior and medial border of the scapula meet. And this one here is the inferior angle of the scapula, and it is the place where the medial and the lateral border of the scapula meet. So we said that here we can see the lateral angle of the scapula, and it is the place where the superior border and the lateral border of the scapula meet. Here, on the lateral angle of the scapula, we describe the glenoid cavity. So this is the glenoid cavity, and it is for the articulation with the humerus. Also, superior to the glenoid cavity, we can see the supraglenoid tubercle. So here is the supraglenoid tubercle, and as we said, beneath the glenoid cavity is the infraglenoid tubercle. Also, we said that we described the superior and the inferior angle of the scapula. We also said that on the scapula we describe three processes. Here you can see the scapular spine. So this is the scapular spine, and it divides the posterior surface of the scapula into smaller supraspinous fossa and larger infraspinous fossa. The scapular spine laterally extends into the acromion. So this is the acromial process of the scapula, or the acromion. And the third process of the scapula is the coracoid process. So here is the coracoid process of the scapula. To orientate the scapula, we use the fact that here on the costal surface or anterior surface of the scapula, we can see the shallow fossa that is called the subscapular fossa. This surface is called the costal surface because it faces the ribs. Then here on the posterior surface of the scapula, we can see the scapular spine. So here is the scapular spine, as we said. Here is the medial border, and the medial border faces the vertebral column. It is parallel to the vertebral column, and the lateral angle you will easily recognize because it has the glenoid cavity. So here is the glenoid cavity for the articulation with the humerus. And as we know that, we can say that this is the right scapula. Now we are continuing with the bones of the upper limb. So we are going to describe the humerus. You can see it here. It is a pair bone, as you can see, And it is a long bone on which we describe the body. So this is the body of the humerus. This would be the proximal, and here you can see the distal end of the humerus. So now here again you can see the humerus. As you can remember, we said that the humerus is a pair bone, and it is a long bone on which we describe the body. So this is the body or the shaft of the humerus. Then the proximal end. Here you can see the proximal end of the humerus and also the distal end of the humerus. First, we are going to describe the proximal end of the humerus. Here, on the proximal end of the humerus, you can see the head of the humerus, and it is hemispherical in shape, and it articulates with the glenoid cavity of the scapula. So if you remember the scapula, you remember that we said that we can see here on the lateral angle of the scapula, we can see the glenoid cavity, and it articulates with the head on the humerus. Then here you can see the anatomical neck. So here is the anatomical neck of the humerus. Here would be the anatomical neck. The anatomical neck separates the head of the humerus from the rest of the proximal end of the humerus. So here is the anatomical neck. It is between the head of the humerus and the greater and the lesser tubercle of the humerus laterally, and between the head of the humerus and the shaft of the humerus medially. What else do we describe on the proximal end of the humerus? Here you can see the greater tubercle. So this is the greater tubercle of the humerus, and here is the lesser tubercle of the humerus. Here between them you can see the intertubercular sulcus. So it lies between the greater and the lesser tubercle of the humerus. And one more thing that we describe here on the proximal end, and that is the surgical neck. This is the surgical neck of the humerus, and it got its name because the most of the fractures happen here. So here is the surgical neck of the humerus, and it separates the proximal end of the humerus from the body of the humerus. And you remember that we said that here we can see the anatomical neck of the humerus, and it separates the head of the humerus from the rest of the proximal end. And the surgical neck of the humerus separates the proximal end from the body of the humerus. So next, we are going to describe the shaft of the humerus. So you can see here the shaft of the humerus, and here we describe three surfaces. This here would be the anterolateral surface. This here would be the anteromedial surface, and here you can see the posterior surface of the shaft of the humerus. Here, somewhere in the middle of the anterolateral surface of the body of the humerus, we can see the deltoid tuberosity, and it is the place where the deltoid muscle is attached. Then, on the posterior surface of the body of the humerus, we describe the radial sulcus. So here is the radial sulcus, and it is the place where the radial nerve passes, and also one artery, profunda brachii artery, together with the radial nerve passes through this radial sulcus. So here is the radial sulcus on the posterior surface of the body of the humerus. And on the body of the humerus, we also describe three borders. So here you can see the anterior border of the body of the humerus, and it is between the anterolateral and anteromedial surface of the body of the humerus. Here would be the medial border of the body of the humerus. It is between the anteromedial and posterior surface of the body of the humerus. And here is the lateral border. Here is the lateral border of the body of the humerus. It is between the anterolateral and posterior surface of the body of the humerus. Also, the lateral border of the body of the humerus distally expands as lateral supraepicondylar ridge. So here you can see the lateral supraepicondylar ridge, and the medial border of the body of the humerus distally expands as medial supraepicondylar ridge. So here is the lateral supraepicondylar ridge of the humerus, and here is the medial supraepicondylar ridge of the humerus. So here we can see the distal end of the humerus, and the distal end of the humerus consists of the condyle, then 2 epicondyles, and also 3 fossas. So here you can see the condyle, and it consists of the capitulum. So this is the capitulum and this is the trochlea. So the condyle consists of the capitulum and the trochlea. The capitulum is actually a hemispherical articular surface that articulates with the head of the radius. So this is the capitulum. Then this would be the trochlea, and also the trochlea is also an articular surface that articulates with the trochlear notch of the ulna. On the anterior aspect, above the capitulum, we can see one fossa that is called the radial fossa. So here is the radial fossa. Above the trochlea, we can see the fossa that is called cornoid fossa. The radial fossa is the place where the head of the radius goes into during the full flexion of the arm. And the cornoid fossa is the place where the cornoid process of the ulna goes into during the full flexion of the arm. On posterior aspect, we can also see one fossa that is called olecranon fossa. So this is the olecranon fossa, where the olecranon of the ulna goes into during the full extension of the arm. So we said that besides the condyle, on the distal end of the humerus, we also describe epicondyles. So this here would be the lateral epicondyle, so it is here, and here you can see the medial epicondyle. So this is the medial epicondyle. Also, on the posterior surface of the medial epicondyle, we can see one sulcus, and this is the sulcus where the ulnar nerve passes. So here is the sulcus where ulnar nerve passes. As you can remember, we said that the humerus is a pair bone, and we need to determine whether this is the right or the left humerus. And I think that it won't be a problem to distinguish the proximal from the distal end. So the proximal end is upwards and the distal end looks downwards. Also, to determine whether this is the right or the left humerus, there is the head of the humerus, and it should be looking medially and upwards. And on the distal end of the humerus, above the capitulum, we said that we have one fossa that is called radial fossa, and above the trochlea we see the cornoid fossa. So here we see the radial and the cornoid fossa on the anterior aspect, and on the posterior aspect we see only one fossa, that is the olecranon fossa. So knowing that, this is the right humerus.